So we're just delighted, Farah, that you could come out here to speak with us. And she completed her postdoctoral fellowship at CAMH, the Center for Addiction and Mental Health, and the University of Toronto, and her PhD at York University. And Dr. Islam explores mental health and service access in Canada's racialized and immigrant populations using both epidemiology and mixed methods research. And she has published in peer-reviewed journals on this topic, so it's absolutely fascinating and wonderful to have somebody who has all of this knowledge about Peel Region and has done research here, so very exciting for us. And she orients her research and community work around breaking down the barriers of mental health stigma. So Farah, thank you so much.
Thanks so much for that really sweet introduction, Liz. I'm really excited to be here today. It is a beautiful spring day, so I really appreciate that you would spend your lunch hour with me indoors, so thank you. I want to start out with saying that we are honored to be here in the traditional territory of the Wyandot and Seneca and Mississaugas of the New Credit Fork Nations. And we are thankful to the many First Nations, Inuit, Métis, and Global peoples who call this region their home. And thank you so much again. So this project is actually from some of the work that I did during my postdoctoral fellowship at the University of Toronto and at CAMH, just as Liz said. So it was under the supervision of Dr. Crown Mackenzie. Maybe you may have seen him speaking in many of the places somewhere. It actually wonderfully has been published in the British Medical Journal Open if you do want to see, if you want to read about it further. So here we are in Peel Region, of course. I actually used to live in Brampton. I live now in Caledon, and we're hoping to move to Mississauga in the summer. My son was born in Brampton. I mean, this is really where I am. So what's actually interesting about Peel Region, though, is that 50% of Ontario's South Asian population actually happens to reside here. It's a huge population, so we really wanted to sort of focus on that for this project. So there are a couple of different growing populations when it comes to Peel Region. Immigrant populations are growing here, racialized populations, South Asian populations, as well as youth populations. So just taking all of that into consideration, we just wanted to really focus on South Asian youth in Peel Region. Now, youth, just generally speaking, are at this really critical period when it comes to mental health. About half of all lifetime cases of mental illness and addiction actually present before the age of 14, and most 75% of them actually begin by the age of 24. And so youth are at this critical time when it comes to mental health intervention. So if we can figure out mental health programs or stigma-busting programs that can be tailored to our different populations, then we can do a really great and enormous amount of help for our South Asian youth. So that's what we wanted to do with this research study. So this was our recruitment poster. We put the top 3 South Asian languages in Peel Region on it to make it sort of eye-catching, people would notice it. It's colorful, it had a comic, hoping that young people would be attracted to it. It was a qualitative study. We recruited 10 young people to actually take part in in-depth, semi-structured interviews. And after that, we did thematic analysis on the transcripts. So what were some of the mental health concerns that young people talked about? Now, I'll spend a little bit of time on this particular slide. So the majority of the conflict and the majority of the stress that young South Asian people have faced in their lives happen to actually be from within the home. They talked a lot about the conflicts that they faced with their parents or their parental generations. And a lot of that came from, obviously all young people sort of face this sort of generation divide or this generation gap with their parents. But South Asian youth talked about this sort of added cultural layer or this added sort of cultural clash they also had to face. And this added a lot of sort of stress and a lot of anxiety in their lives. And this happened to be sort of in these 2 domains. First was academic pressure, in the sense that their parents and their grandparents had this really different idea of what it means to be a success, right? How well you should do in school, what type of career choices or career paths are open to you, right? It's just a really different idea often. And then the other was in terms of relationship stress. So young people had different ideas when it came to, what does it mean to date? What does it mean to interact with other people? And how can you get married or have relationships, all of that. And so there was a lot of conflict that came out of that as well. Young people also face some financial stress. Often this was sort of directly related to being the children of immigrant or refugee parents. If their parents were in this sort of financial struggle, young people may have taken on second jobs or been not only going to school but also working to try to support their families, and so they kind of often took on this parent type of role. This was also related to if they lived in a divorced or separated or single parent household. And there again, South Asian youth talked about how they often felt they had to kind of be the partner of the single parent that they now resided with, and kind of be there to be the shoulder that they leaned on. And so again, that was another source of stress often in their lives, because it's hard to take on those really grown-up roles when you're just a young person battling with your own stresses in life as well, right? Young people also talked about mental illness being present in the family, and that being something that was often hidden or shoved under the rug. It was very interesting because a lot of the young people that I talked to were often in mental health services or currently seeking some type of mental health counseling or something at the moment. And they talked often about how it seems likely that their mothers had some type of postpartum mental health issue, maybe postpartum depression, whatever it was, and they didn't have the opportunity to seek help for it. And that had sort of these far-reaching ramifications and long-term consequences for the family. Now you have the mother who's suffering, and then it obviously impacts their parenting and how they are, right? And so then their children then went on to seeking mental health services as well. So that was a very interesting pattern to see. And then young people were also candid about substance use as well and addiction. So we'll talk more about that. I'll present some of the quotes from the young people because it's always best to hear it in their voices. So this young person talks about how she was obviously a child of first-generation immigrants and how that's difficult, right? How that's sort of a struggle because of that clash of the different values at home. And again, that whole sort of family conflict from that sort of double-edged conflict that occurs at home. Young people also talked about how, everything that this person did for his parents, it was kind of always compared to other people, right? They just had these really high expectations. For example, he said he was compared to doctors and engineers, even though he was in grade 4, right? It was just really enormous, right? Enormous expectations, and just sort of this real sort of obsession with family image and what other people are going to say, et cetera, et cetera. So it's really hard. Another young person talked about how, traditionally in her culture, you don't date, but she wants to date, right? Because it's something everybody else does around her. And it's difficult because she wants to be in that romantic relationship, have that closeness or have that intimacy, but she also feels a lot of guilt weighing her down because it's something her parents wouldn't want her to do. So what about addictions? This also was really interesting to hear. I found it, there are certain South Asian religions, for example, in Islam, where drinking is actually forbidden and we are not allowed to, for example, any type of substance. But here, some of the Muslim youth were actually really candid in talking about how, even though it's not allowed in our faith, there are a lot of Muslim kids who are drinking and doing other types of drugs. And so they talked about how, although it's not allowed in our faith, hey, there are a lot of people who are doing this. And this young person kind of had the insight to talk about how, some young people turn to different substances because it may be that their parents are going through divorce or just different sort of issues or situations are happening at home, and that's kind of how they're coping with it. And other things that they may turn to as well may be violence or gangs as well. So again, these are just sort of coping mechanisms that young people kind of use to get through some of the pain or the issues that they may be facing in life. So what were some of those mental health service access barriers? We're here in the hospital, we want to know about barriers to care often. So young people talked about how this sort of incredible barrier, the biggest barrier that they usually identified was that of mental health stigma. And they talked about how, for example, let's say the family does want to take the young person to care. They recognize that there's an issue going on, maybe it's at the crisis point. But they're so afraid that if everybody finds out about these issues, you're going to just have these huge ramifications and huge consequences for the family. For example, they were often really afraid that if it was a daughter, that young daughter wouldn't be able to get married. If it was a young boy or a young man, they often felt that he wouldn't be able to hold down a career or get a job. And so there was just this incredible fear of consequences. And another sort of part and parcel of that is that sort of part of our cultures, it's really bizarre or odd to go to a stranger for help, or to tell a stranger about all your most intimate problems. And so this idea of counseling is sort of a foreign concept often for a lot of our parents or for our grandparents. And they kind of just don't encourage that within their children to go to talk to someone about it for that reason. So what about mental health literacy? I talked to the young people about, how much knowledge do you feel you have about mental health resources in Peel Region? So I kind of put the logos of 13 different mental health resources and services in Peel Region, and put a little bit, like a little blurb of knowledge about what that service is about. And these were sort of culturally specific mental health resources, youth-specific resources, and then just mainstream resources as well. And just generally speaking, young people just didn't know a lot about the mental health resources that were available. And these were often young people that were in mental health resources or mental health services or seeking counseling themselves, right? And even then, there was sort of a great lack of mental health literacy. The majority, of course, knew Kids Help Phone Line, which is everywhere, right? It's on our juice boxes from when we're kids. It's everywhere. They've done a really good job of marketing it. But oftentimes other mental health services and resources don't have that kind of funding or that kind of reach or scope. So what were the recommendations from young people? You want to be action-oriented, right? We can learn about the mental health concerns and the barriers, but it doesn't really mean a lot until we can put that into action and actually do something about it. So I kind of put the young people's recommendations into sort of a multi-level kind of model, right? They had recommendations for parents, for the school system, at the community level, and at the mental health system level. And because we are here in the hospital, I'll focus on what the recommendations were for the mental health system level. So in terms of mental health services, they really kind of wanted to see greater diversity when it comes to the mental health professionals that we have. Just a greater sort of need for racialized professionals and the need for more specialists. So those who are actually specialized in youth issues, right? So this young person said, again, just psychiatrists who know about youth, and then they wanted to see South Asian faces as well. But I do want to say there's a caveat here that a lot of young people also said, I wouldn't go to a South Asian professional, right? Because that feels too close, or I feel that person wouldn't necessarily understand me because of whatever their cultural baggage may be, whatever the reasons were. So what we need really is just generally across the board greater diversity, and to allow them sort of the choice to choose what professional they would want to be matched with. They also wanted greater diversity when it comes to models of care. Now, some young people sort of felt a lot of hesitance to seek mental health services because they felt that there was too much of an emphasis on medication or Western psychotropic medication, as well as they also felt that sometimes the care offered was too secular and that you were kind of left on your own to figure everything out. That you couldn't rely on the support of your family or the people or your loved ones around you. And so it kind of felt that recovery was just this really, really isolated process. But on the other hand, we had a lot of South Asian youth that said, no, the opposite, that they really like the Western model of mental health care as well. And for example, this young person said, she learned all about different psychotropic medication, and she went to her mental health professional and said, I want to go on antidepressants. So we have, again, that really huge diversity of different ideas and different wants and needs. They also, though, this one I think they were all kind of in agreement with, was the sort of lack of imagery and representation when it comes to mental health information, mental health advertising. So generally speaking, South Asian faces or different racialized faces are not really, what can you say, represented in our mental health imagery. So this is the quick guide, of course, maybe you've seen this, for Peel Region and Dufferin County. If you look through it, generally speaking, there's not really anybody exactly you could identify as a South Asian face. Now, this is obviously in a broad kind of way, but it's kind of missing, right? So this young person said, I just don't feel I'm targeted when it comes to mental health resource information or counseling or anything, and that makes them feel not included. And sort of the dangerous sort of idea that arises out of that, and why that's so problematic, is that young people then sort of have this idea that, for example, she said, only white people suffer from mental illness, right? It has nothing to do with me. It has nothing to do with South Asian populations or my people or anything, right? It's just them, not us. And that's not true, right? Our statistics of mental illness are just the same, but we don't recognize that, or again, we push it under the rug, shove it under the rug when we feel that way, right? So we need our faces as well in this mental health promotion. For example, this young person said, I'd love to have posters that have a woman wearing a hijab, right? I'd love to see that. I'd love to see myself represented, just so I can feel that, this service is also for me. And another thing, we're lacking in targeted outreach when we think about the way young people communicate, right? Young people are just online, right? That's where they go for their information. And so, we can print lots of brochures or make posters, and that's important for sure. But young people, generally speaking, the way that they communicate is through, Snapchat, Vines, all those different types of things. And me just saying it probably means it's probably really uncool now, right? They're probably doing 500 other different things. That's how they communicate. And we also, if we want to be relevant to young people, we need to be communicating in their language as well. So offering services that are really anonymous, 24/7, non-judgmental, confidential, all of that. Young people like texting services or online sorts of maybe online chat kind of services or whatever it is. It's different. It's different from the face-to-face meet with the counselor in front of you. So we have to kind of think outside the box when it comes to re-envisioning or reimagining what mental health services need to be for South Asian youth. So the Peel Region and Dufferin County resource guide's actually been revamped in recent years, and a couple years ago, but it has the same problem. There's still no faces on it, and again, it's again kind of problematic. Now you have to remember that Peel Region is home to 50% of Ontario's South Asian population, right? So again, that should be represented somewhere on that guide. So hopefully, maybe they'll have another iteration of this one. So what are the next steps? So for this particular project, we also interviewed almost 40 service providers. So mental health professionals working with South Asian youth in Peel Region, educators, spiritual leaders, just a huge sort of number of wonderful people that were really passionate about giving their ideas about what we should do. So that's what we're actually analyzing right now. What's great about going through particularly the mental health service providers interviews is that they give really, strong, actionable, intelligent ways that we can offer evidence-based care for South Asian youth, right? How we can actually build rapport, how to build those bridges into the community, how we can best dismantle mental health stigma in the community. So just trying to take all those guidelines and put it together in a really great paper, I hope, soon. Hopefully we'll submit it this year. So that's what we're doing right now. Also taking one of the recommendations by the young people. They said at the community level, or at the parent level really, that what we need to be doing is doing the dismantling of mental health stigma for our parents and for our grandparents' generation. That would make it easier for young people to be able to seek mental health care, right? If their parents were open to this idea, didn't think it was so awful. So what we did was that I took a lot of the findings, just my my experience working with the community, and went into a space that I work in or I reside in, and then made it into an online course for parents. So it was called Muslim Youth Mental Health, and it was offered in one of the biggest mosques on the east side in Scarborough. And it had a really great turnout, right? Lots of parents, lots of mental health service providers as well. It got a little bit of buzz. It was on Metro Morning, CBC, and Ottawa Morning as well. And just, it was really great just to see all the community get out. And it was just such a great opportunity to sort of dismantle some of that mental health stigma, right? To talk about mental health, but packaging it in a way that, bringing in Islamic scripture and history, and just, talking about it in a way that's comfortable for people, right? That it's not so foreign for us as well. It's actually part of Islamic history and part of our tradition and part of our knowledge, but for some reason that's been buried. So let's revive that. And so that's what I tried to do. So I wanted us to talk actually about kind of what we can all do together. Now, what I think we've talked about a lot is that one size doesn't fit all, right? Young South Asian people, young South Asian youth, they want diversity of professionals. They want people that are versed in youth issues. They want different models of care, both Western and psychotropic models of care, as well as other models of care, bringing in mindfulness or other traditions as well, which is fantastic. One way that we can, if they want to see more South Asian faces or more racialized faces in mental health care, then one thing that we can do is professional mentorship, right? That's a way that we can sort of provide that sort of support and way for other people to rise above in mental health services as well. Another is, of course, creative thinking, where we talked a little bit about how young people communicate differently, right? We have to be able to communicate like them too, otherwise this becomes totally irrelevant. And the last and the most important, of course, is to end mental health stigma. It's not just in South Asian populations that mental health stigma exists. It exists in all societies, in all communities. And if we can't dismantle this, it doesn't matter, we could create amazing programs, amazing tailored services, but if no one's gonna be able to have the opportunity to seek those services, then it's all for nothing, right? So I wanna talk about what we will do to end mental health stigma. We all have a role to play. I want you to think about maybe the spaces that you reside in. It could be the workplace, ending workplace mental health stigma. It could be the communities you reside in. It could be your family, right? Sometimes the most powerful conversations we can have in regards to mental health stigma are those that we have at our dinner table, right? That's where we can really start to break down some of those deep-seated beliefs. So I want you to jot down one concrete action item that you would like to do, you take on as something that you would like to vanquish and to help end mental health stigma. And then I want you to share it with your neighbor. And if you're really brave, you can also come and write it on this lovely giant sticky notepad paper here so that everybody can sort of be inspired by what you want to do. And we can all work together on this. So thank you so much. I'll keep this up for a little bit afterwards, but that is the end of my talk. Thank you so much. I really appreciate it, and I welcome your questions as well.
Did you want us to do the exercise first,
Is that
or take the questions now and then do the exercise? What would you like?
Is it okay if you do the exercise for 5 minutes, Sam? Is that
Yeah,
okay?
absolutely.
Yeah, okay. Thank you.
Thanks. Thank you, Farah. I really enjoyed your presentation. I wanted to ask you, you were talking about the importance of having more diversity in our mental health care teams. I wanted to ask you about the issue of gender, and if you had any thoughts about that. Like, was it important for youth, for young men to be seeing male or women to be seeing women providers?
That's a really good question. It kind of both. Again, they said sometimes they preferred having gender matching and sometimes they didn't. Also, they talked about how LGBTQ issues and gender identity issues were really difficult. And so I can only imagine that if you are struggling with your gender identity, that you may want to also talk to a counselor that has, or at least an understanding of what you're going through. So just again, the need diversity or choice. Yes, sir.
Thank you for your presentation.
Thank you.
I wanted to ask, so it's a two-part question, and one part was about the LGBTQ, and if you had feedback from your participants around that, and if you could share more of that feedback. So that's the first part. And then the second part is, did you notice differences or similarities between refugee immigrants versus non-refugee immigrants? Because I think there may be something there. And I also just wonder about what services candidates might offer towards refugee immigrants.
Okay.
Yeah.
Great question. Three questions.
Yeah,
That's really good.
Whichever one you want.
So the first question, in terms of the youth, they didn't talk so much about the LGBTQ issues or gender identity issues. I did though see that when it came to talking to the mental health professionals and to other people who deal with young people. They may have, felt inhibited to talk about that with me. That's totally fine. But yes, definitely they brought it up, or professionals did, and just the sort of need for diversity again, and how that's again a part of that cultural conflict or that family conflict, needing to hide that or that double identity often in the home. The second question was, tell me again.
Yeah, refugee.
Okay, perfect. Nobody identified as being a refugee, a youth. Everyone was either an immigrant or Canadian born. So I'm sorry, I can't speak to that. And in terms of refugee mental health, I know there are training programs, for example, going on currently at CAMH to teach professionals about immigrant and refugee mental health issues. In regards to services specifically, I would need to look that up for you, but that's an excellent question. Thank you. Any other questions? Should we read out the wonderful bits on our notepad? And you can think about questions, or you can email me. That's totally fine too. So, one person beautifully said, have conversations with staff on how I can support change. So again, workplace mental health stigma is really important to try to dismantle. Describe a real story with my parents. So true, so true. Again, those dinner table conversations are so powerful. We often think, again, it's them, not us, or it has nothing to do with our family, etc. Talk about it. Yes, talk about it. It's just a regular, how we talk about health, how we talk about getting the flu. Again, we can talk about mental health issues as well. Share your story, right? If you have lived experience, or if you had to take care of a loved one, or seen someone go through it, again, talk about it. We all need support, right? Identify and address stigma, absolutely. Attend to language, yes. It's really scary sometimes, the insensitive things we say. So yeah, that's beautiful. Help people help themselves, exactly. Direct to available services. That means we need to be knowledgeable about the services that we have. Talk about the issues with the younger generation in the family, yep. And the old generation, of just, yes, all across the generations. It's very true. A lot of professionals, for example, talked about how the parental or the grandparental generation kind of hid issues of mental illness. There were lots of stories of actually mental illness within the family, but nobody knows about it. And so when the young person went in for services, that was often the first time they heard, oh, wait a minute, grandma had bipolar disorder? I had no idea, right? But it was totally hidden, as if it wasn't relevant to them or wasn't important. But it's absolutely important to young people across all generations. We need to know our family history. With family, friends, and community, market and share mental health, promoting smartphone. Yeah, exactly. Yeah, we need to go into the smartphone revolution or into the digital revolution where, yeah, I'm really bad with that, but we need to be up with all of that. So that's fantastic. Thank you so much for participating and for sharing your knowledge and taking part in this. We all have a role to play in dismantling mental health stigma, so I really appreciate that you're here taking part, and I hope you can enjoy the beautiful sunny day as well. And I'm here as well a little bit afterwards too. Thank you so much.